Welcome to There's a Lesson in Here Somewhere. Conversations with interesting people with fascinating stories to tell and from which we can draw important lessons. Here are your hosts, Jamie Serino and Peter Carucci.
Hello and welcome to There's a Lesson in Here Somewhere. I'm Jamie Serino.
And I'm Peter Carucci.
And we're here today with Sara Weand, a licensed professional counselor and a dialectical behavior therapist, or DBT. So we're going to speak with Sara today about DBT and about borderline personality disorder, BPD. The psychology field has 1,000 acronyms. So these are two topics that we could speak about for hours. So we're happy to explore those with Sara today. Sara, welcome.
Thank you.
Sara, why don't you start off telling us a little bit more about yourself and about your practice?
Yeah, sure. So like you said, I'm Sara Weand. I have my master's degree in clinical counseling, and then I went further and I got my license in psychological counseling. And I went further than that and became a dialectical behavior therapist, or DBT therapist. So I have been doing mental health work for 25 plus years. So this is very much my wheelhouse. I specialize in borderline personality disorder, BPD. It's something I'm very, very passionate about. I started my career way back right out of college doing a lot of different community work. I've done some group home work, and also worked in some outpatient facilities and some inpatient things. And eventually I ended up doing my own private practice, just based on, I wanted to work the way I wanted to work. I wanted to see the clients I wanted to see. I wanted to focus on the things that I felt were important and have my schedule that I want, and basically be in charge of the way I work. Because if I'm happier, if I'm effectively working, then I'm more effective working with my clients, right? So many years in the making, and then here I am starting. I opened my doors, I believe, in 2018, doing my private practice. So I've been doing that. My whole practice is virtual. So as long as someone is in the state of Pennsylvania, that's where I am licensed. Their feet need to be physically somewhere in Pennsylvania, and I can work with them. So the virtual practice has allowed all kinds of people from across the state access me, because borderline personality disorder is a very complex disorder. Not many people like working with BPD, and there aren't that many clinicians that work with BPD or are trained specifically in the gold standard, which is dialectical behavior therapy. So it allows people to access me and me with them. And it has worked beautifully, I think. I started doing that even before COVID. So it's very much what my comfort level is. I enjoy doing it.
Great. Why don't you just tell us a little bit more about borderline personality disorder? Because I feel like, we've been hearing a lot about it over the years, and I think some people understand what it is, some people may not. And so why don't you just start there? What is borderline personality disorder?
Yeah, absolutely. And it is a very complex disorder, and there's so many it's a complex disorder, right? So when we talk about BPD, it's a mental health disorder that impacts how someone experiences emotions, relationships, identity, how someone thinks and behaves. Clinically, we talk about 5 patterns, right? We talk about 5 patterns of dysregulation. So we talk about emotion dysregulation. We talk about impulsive and self-destructive behavior. We talk about unstable and chaotic relationships, black and white thinking, and also a shaky and constantly shifting sense of self, right? Let's be honest, though, that's not how we capture the raw of it to actually live with it. Okay. So what happens is people who have BPD living with it often feels like their emotions are constantly hijacking their life. Okay. So the emotions feel intense. They hit hard and fast. It's out of nowhere. When experiencing negative emotions, right, it literally is painful for them. So one of the quotes I often explain to people, Marsha Lanahan, and we can talk more about her later. She's the founder of Dialectical Behavior Therapy. She has said, which I think just hits the nail on the head. She has said something along the lines of, borderline individuals are the psychological equivalent of a third-degree burn patient, right? They simply have no emotional skin. So, okay, so what happens is, because the emotional pain is so intense, they'll literally do anything to make that pain stop when they're feeling a negative emotion, right? So in some ways, people with BPD often become what I would call emotion phobic. Like, they'll do anything to not have to feel that devastating emotional pain, right? So this is where the impulsivity comes out. This is where, like, the life-threatening stuff, like the cutting, the suicidal threats, the excessive substance use, like the damaging, destructive relationship shit, like the behavior, like clinging, excessive texting, raging texting, all this stuff. So on the outside, yeah, it looks like crazy shit. Okay. Their nervous system is literally on overdrive, right? So they're constantly on the lookout for being rejected or abandoned. So trust me, they don't want to act crazy. Okay. They are just so desperate to not feel, just to make that pain stop.
Mm.
So, yeah. Well,
Yeah. So you said a few things there that you know I have some follow-up questions.
absolutely.
So I'm really glad that you said that about, it's their behavior, ends up being a reaction to how they
Hmm.
feel emotions or how they're processing information that's coming to them. And it's not necessarily, I guess, to excuse bad behavior in
Right.
society, right?
Oh, yeah.
But you can have at least a reason for it, and that helps you then. Well, let's work on this, right? So how would how did you become involved with wanting to work with people borderline personality disorder?
Well, initially I thought, no, I'm not doing this. Initially, okay. And I was working for the state hospital system in Pennsylvania, and an opportunity presented itself, and I thought, ooh, I love to learn. I will be part of this DBT consult team. We can get to what that means and what that looks like later. But the idea was, I was privileged enough to go to this intensive training that was paid for. Okay. Um, and that is the piece that really helped set the stage, right? And I've it's not a once and done learning process, right? It's like a constantly, you can't just go once and it just sinks in, right? Like, this is something like I practice in my life. Like, I view the world, like we were talking off camera earlier, like I view the world, like I do believe that DBT is a lifestyle. We can get to that. How did I get to working with people with BPD? So, um, there's kind of this, people often ask, like, why am I like this? How does this happen? Like, why am I like this? Okay. And I'm going to answer your question. I'm going to kind of go around and get to it, if that makes sense. Um, so for people that have a BPD, right? What happens typically, okay, is I look at what's considered like a biosocial theory, okay, and what the biosocial theory states is that there is a biological component, okay, to emotion vulnerability, okay. What that means is this: like, we all are born with a certain biological predisposition, okay? So there are people that are simply more sensitive emotionally, okay? So I am, okay? My mom is. I know my daughter is, okay? So there's a biological piece, and what does that mean? Okay, what does it mean to be highly emotionally sensitive? Okay, so what that means, okay, is that, like, I was the kid who cried very easily, okay? Someone would look at me or I would get hurt feelings like nobody's business, okay? I still do, right? I just have the skills now to kind of, my brain not process it that way.
Yeah.
So there's people that are highly sensitive emotionally, okay? They're just more sensitive to emotional stimuli. So I often explain to people that it's very similar to what pop culturally perhaps like an empath, like if you know what that means, right? So, yeah, um, eh, for people that have BPD, okay, they th- and for people who are highly emotionally sensitive, right? Like there's like an intense emotion, right? It kind of comes out of nowhere and it can be long lasting. Now, what can happen, right? And this is why I can identify. I enjoy working with people because I've been called like the whisperer of this because I think I get it, and I'd like to say one of the reasons is because I'm also highly sensitive. Now, the other part of this BPD soup, how it happens, right? This I didn't experience this, right? So there's this biological piece, and then there's also the environmental impact. Okay, so I was fortunate enough to grow up in a family and have an environment that supported this high sensitivity, right? Like I was very much like it was embraced, here are these are, I was musical. I'm artistic. I still am. Like if someone is raised in an environment where there's this high emotional sensitivity, right? And the family or whoever the environment is, they don't know how if they're not highly sensitive, they're not going to get it, right? And I'm not saying like families are purposely trying to mess up their kids. What I'm saying is they don't get it, right? So they're trying to help navigate these, intense, like why is this kid crying all the time? What is happening? Like, gosh, this is no big deal. So what happens is the environment, right, is uh, it becomes an invalidating environment for people. Okay,
Yeah.
yeah. So what that environment does, right, is it communicates to the people that are highly sensitive, like something wrong with you. You're weird. You're bad because you can't control the emotions, right? So it ignores the reactions and does nothing to help that person, right? So it's the message like, what's wrong with you? Can't you be like more like your sister? She doesn't act like a crazy person, or like, my God, this is not a big deal. Okay, now again, like we're not like no, they're not. Most families are not trying to do this. They just don't know how to. They just want their child to stop crying, or they just want
It's like parents don't get some manual, right?
right.
And so this is where like a therapist working with a child, a lot of times it helps to work with the parents too, because your child, this is how your child is, and this is how you should parent that child. But without that, parents are thinking like, oh, that kid's not listening to me, they're disrespecting me, or they're this or that, or this child's fine, that child's not, and everything you're saying, right? That tends to happen. So with the biological component, you have an environmental component that could, like you said, invalidate their experience and their feeling. So what do you think about sort of like recent-ish the recent-ish time period that has led to an increase in diagnosing BPD, and what were happening with people with this sort of, this experience? What were they diagnosed with previously, or were they just not being helped? And could you talk a little bit about that shift, that arc?
Yeah, it's still being misdiagnosed, right? So there's some very similar. A lot of times, the symptoms or the behaviors, different diagnoses, like there's a lot of similarities, so I can see how it would be easily misdiagnosed. I can, your first question had been about why is it more often seen or talked about now, and I think
Maybe like diagnosed a little bit more now lately, but I think also, to your point, talked about more. I feel like it's talked about more, in the mainstream, I think, and even in culture, you might hear it in a show or a movie or something like that. And I just feel like the level of awareness of it is raised. And I'm wondering like about that arc, and I imagine that's been helpful, but what has caused that additional focus on that, and what has been the effect of that?
I think it's twofold, right? I think that a lot of times people will often, like, I think clinicians do this, and I don't blame them because it's just how people are taught, right? Any kind of difficult behavior, is often seen as being manipulative or borderline. Okay. So like just because someone's being difficult, okay, or it's a difficult situation doesn't make someone borderline, right? So like that's huge. Okay. Um when I talk about the behavior patterns, like initially when I was like, okay, so there's a couple things that play here. A lot of times people will believe or say if there's any kind of self-harm at all, it's okay, that's borderline behavior. Not necessarily. Okay. Because life-threatening behavior can occur with all different kinds of diagnoses, right? One of the reasons I also work with people with trauma is because trauma from PTSD, those symptoms play together. Okay. And there's nuance to, did the trauma cause all this, or is there something more, or is there something else going on? Right. So that's why I do a very, very thorough assessment, right? Because I can tell the difference. Um, a lot of times people with BPD are often misdiagnosed as bipolar. Okay. And what bipolar is, and I'm not an expert in bipolar. What I am aware of it is that there is a pattern of highs and lows. Okay. The highs are like what people think of as like manic. There's a lot of excess energy. There's like days on day, days and days and days of not sleeping. And then on the other hand, there's like this, the bottom, right, is this depressive stuff where people become suicidal. Okay. And then in between, there's like a period of like a little bit of stability. Okay. I can see why someone who has rapidly shifting moods would be diagnosed with bipolar disorder. The key difference is this. Someone with borderline personality disorder, their moods are not going to be shifting like that days upon days upon days. Their moods are going to be shifting over dinner.
Mm.
And most of the time it's in response to some sort of perceived or not, it could be a real legit like of rejection or abandonment or some sort of relationship issue. Okay. Um, I often, and I wish I could take credit for this. I can't. I don't remember where it came from. But what I explain to people is BPD is not an island. And what I mean by that is you could put somebody with schizophrenia, with depression, with bipolar disorder, all different kinds of diagnoses, even anxiety. You can put them on a deserted island, just observe them, and their diagnoses and their disorder would still be present. You could see it happening. Okay. With depression, you could see someone, they probably sleep all day, right? You might see them crying. You might, for someone that has schizophrenia, it might be they're responding to something that's not there, unseen stimuli, whatever it is. With BPD, you only see the dysfunction in the context of relationships.
Hmm.
That's where dysfunction comes out because you would not see it any other way. Yeah.
Wow.
Yeah. And so I really try to teach people this, right? Because a lot of times someone could be moody, okay, and there could be a whole other shit problems going on. And it's not necessarily, it could be part of BPD, it might not, right? So it's a complex thing, and I see why clinicians misdiagnose it. I get it.
You have to look at what causes it per individual, like the trauma or the PTSD, or is it something generic? Like I'm very fascinated with causality here. Like what creates someone? What? How does bipolar? And I'm sorry, borderline personality disorder uh, gain a footing in someone? Kind of story.
Yeah,
Yeah.
no, and I love that question. Like, so when I talked about like the biosocial stuff, right?
Yeah.
Like there's that bio piece, right? The high sensitivity, right? And then also there's that it's a chronic invalidating environment. So like um let's say there's it might not even be within the family. It might be in the school system, right? It might be with or it could happen maybe perhaps later in life and someone's with an abusive partner, and think about how an abusive partner could create
Like
an
that situation.
environment of invalidation, right? So you take that, you take somebody that has, the BPD soup, I like to call it, right? It's like the invalidating environment, the high sensitivity, right? And what happens is, okay, social environment actually ends up reinforcing that crazy behavior that no one likes. Because what happens is that person's like, they're feeling a thing. Okay. Let's say, oh hell, I don't know. Let's say there's a couple and they're dating, okay, and like they're planning on going out to dinner. The girl comes home, her boyfriend's asleep on the couch, right? Okay, they had plans. She might be disappointed. Okay. Realistically so. Like, okay, maybe, like they're why isn't he ready? Does he not love me? Whatever. Like there's misread, so she's believing that her boyfriend's like blowing her off. Of course you're gonna be upset, right? The problem is when the environment says, what the hell's wrong with you? I was just taking a nap. Why are you so dramatic? So it just increases the behavior, not consistently reinforcing. I'm just giving a random example, but like, it's not just that once and over, it's this reinforced pattern. They're being reinforced for their out of control behavior.
Right.
Does that make sense?
Hey,
Does that answer?
yeah, I think that is a good example. The misreading of something, and so I guess at times, like if it is a relationship, they say opposites attract, and sometimes that's good, but maybe that's not good in this case. But what would you say to someone who maybe thinks, I think my partner has BPD, or I think
Mm-hmm.
my child might have it, or my boss has it, or something like what would you say to them? Just in terms of like, dealing with that, or if it is a person that's close with them, where they could maybe recommend, why don't you see someone, and what would you say in terms of, I guess this is also finding the line between they're stressed out, or they're this or that, or they've got BPD.
Another great question, and I hear this all the time, legitimately. Okay. Um, uh, it also depends who you're talking about, right? If it's I hear about family members or close friends a lot. Um, they'll say, "Oh, I know this person. I don't even know. Doesn't matter what I say to her." And I'm going to say her because most of the time it is. Unfortunately, I'm going to default here. Um, you know, it doesn't matter what I say. She just flies off the handle, or she just constantly misreads all these things. The biggest advice that I give to people is this: even if it sounds like the most crazy, absurd, preposterous thing that the other person is saying, you look for the kernel of truth. You might have to really look hard to be fair.
Yeah.
Okay. Um, because people that have BPD or people that are suicidal, there are often very good reasons they're feeling that way. Okay. So the message here is validate, validate, validate. Only validate what's valid. Okay. So for instance, let's say someone is, let's see.
I like that a lot. Only validate what's valid.
Yeah.
I'm
No, you don't blow
fixing it.
smoke. No. Yeah.
Love that.
And I like the kernel of truth. I mean,
There's always
you're saying some wonderful things here. Yeah. So
there's always a kernel. Now, here's the thing. Okay. Let's say, I watched Marsha Linehan, founder of DBT, do this role play from years and years ago, and I was like, this is gold. She was doing a role play with I'm going to set the scene. It was a man who, apparently the backstory was that he and his wife got into an argument of whatever, and in the process of grabbing her, he broke her wrist. Okay, now he kept saying, Marsha, you don't understand. She said this. I was so hurt. I didn't know what to do. And I just grabbed her. Now, she didn't say, oh, well, I get why you grabbed her. No. She said, your feelings were hurt and you broke her wrist. Do you see what I'm saying? There's no, oh, I get why you did that. It's like, well, no wonder you did. It's your feelings were hurt and you did this thing, right? Because people often think with validation, it's like sugarcoating or it's making irreproof. That's not what it is, right?
yeah,
What is that kernel of truth? It could simply be, you believe this thing and I believe this. It does not mean, again, agreeing. So you only do want to validate that. So when there's people that consistently say, and I'm saying this, I mean, crazy sounding shit. Okay. I might say something like, oh, wow, that sounds really hard. Because it's true. Like, and I'm not blowing smoke up their ass. Like, I'm being serious. Like, it sounds hard if you're dealing with this, of course, or, wow, other people in your shoes probably would feel the same way. Again, it's valid.
Yeah, because if you validate their experience, you're sort of telling them like, you're not crazy, right? It's valid what you experience. Now let's work on how you react to those experiences, right? I guess.
Absolutely. And let's be fair here. We've all done crazy shit. Okay. Again, true, um, and again, like when you're like, how not to react. I mean, that's what DBT does. There is a whole complex treatment, but we can get there whenever you're.
Well, yeah, no, Peter, you had a question.
Yes.
Well, I'm wondering, like, for a few things. I just gotta give a minute some processing. So, like, I couldn't remember the difference between bipolar and borderline. So I have Madonna's song "Borderline" in my head. Borderline, that's how I know we're talking about borderline personality disorder, right? BPD, and um, and it essentially emanates from someone who's emotionally in touch, right, biologically, who
They're very, very sensitive to emotional stimuli. So like they can pick up on other people's emotions pretty quickly. They won't,
but society or their local, whether it's their family or it could be school or a
yeah, the
relational
environment.
abuse, creates this invalidating environment for those emotions. Am I right?
Yeah, they're being told like, hey, there's something wrong with you because you feel too much.
Right.
That's the bottom line. Yeah.
So I just did a lot of armchair research for a song that I just finished, which was about certain kind of relational issues,
Hmm.
like avoidant attachment style.
Okay.
And I wonder the difference between that, which is like, people avoiding emotions, and BPD. Like, for example, is the difference there that someone who just avoids that emotion or is taught to avoid emotion, maybe that person doesn't necessarily have the same kind of biological sensitivity that someone who has borderline personality disorder. Is that right?
When I say emotion avoidant, the reason that they do that is because it's been communicated to them that the way that they respond to emotions is wrong or what they're feeling is wrong. So it's and it's been communicated like peace at all cost. It's usually a lot of people come from households where it's like we must always have a smile on our face, right? We must always pretend like everything's fine, even if, there's a lot of chaos going on, because we have to have this happy family, right? That's why I have a real problem with these sayings like good vibes only, or because that's just reinforcing this shit, right? Like I understand like the I understand that why people want that, right? But sometimes shit is just shit. And if we're trying to say, oh, don't be upset about that, that's not a big deal. Well, then you're teaching that person that maybe I'm not feeling the right thing. Maybe I need to just not feel, you know what I'm saying? So when someone feels hurt or scared, most
Yeah, you don't know. Yeah, I had a boss once ask me, how do you handle conflict avoidance? And I said, how do I handle it? I don't avoid conflict. You have to deal with it. And that's the right answer. And I was like, oh, okay. So I wonder, is it kind of taught to them to avoid, meaning by borderline personality disorder, is it taught to them essentially like you need to avoid this behavior, uh, those emotions rather, you need to avoid that, and that invalidating nonstop is what I'm trying to put together. Is
it's a
that what
great and
some of is harming themselves here,
Yeah.
right? Is that right?
Yeah, like here, okay, so a lot of times people are instructed not to feel a certain way without being told how to change their behavior or how they're feeling, right? Because we can change how we feel sometimes. We can change our behavior. But if someone's just instructing you, stop doing that, how are you going to stop it if you're not taught how to stop it, right? Or does that make sense?
It does. It totally does. I'm just thinking of examples of people that I know or have known that have, like, the cutting and things like that. And how does I can't process how that kind of avoidance of emotional and that emotional avoidance and invalidation creates someone to arrive at that point where they're harming themselves. I've never been able to.
I can totally answer this for you. So, because I get excited about it. Yes.
I
Get
don't even be excited
excited
about the negative thing. I never understood this. Sorry.
No, it's fine. So when people are under excruciating emotional pain, right? They will literally do anything to make it stop, right? Sometimes it's going out and sleeping with the whole bar, right? It could be like they're spending money they don't have. This is the impulsive behavior. Somewhere along the line, there comes this desperation where they're like feeling so unbelievably horrible. And remember, like people with BPD, it's like it hurts. Like it physically hurts to feel emotional pain, right? So what happens is someone might cut themselves, some people burn themselves. And what happens is I'll often ask people, well, did it help? They're like, no, 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 I'm so bad. I cannot believe I did that. I'm so embarrassed. I'm like, think about right after. Because more often, like what has been found, right? And what people actually, it's like the light bulb moment is for a split second, there's relief. A split second of that, like relief of not feeling that emotional pain because of whatever, there's something that happens that when someone hurts themselves on purpose or goes on a cocaine binge or goes on whatever, with the cutting in particular, there is a split second relief. And that is enough to be reinforcing that it might work. So they keep going back to the same thing over and over because it gives them that little, doesn't last, because after they do it and that split second's over, then comes the shame, then comes the embarrassment, then comes, because not everyone who cuts, not everyone who does this does it in front of people. In fact, most people don't. Most people do it like they'll cut like their inner thigh so that way no one will see, or around their hip. But yeah, so it's
Yeah, and that takes away the argument that they're doing it for
yeah.
attention.
Now, perhaps they don't know how to ask for help, and that's their way of getting someone to help because that can reinforce it too. Well, a lot of what I do is, okay, what is reinforcing about this problem behavior, whatever the problem behavior is, whether it's cutting, whether it's overspending, whether it's reckless driving, right? Whether it's rage texting your boyfriend because he didn't get back to you right away. There's a whole spectrum, right? If it's a behavior that's problematic, that's what we're going to look at. And what is making it stick around longer? What's keeping it? Because we only engage in behavior that's doing something for us. Like if it weren't
Right.
doing
Positive
something,
or negative. That's right.
yeah.
I have a weird question too. I never actually thought about it till you mentioned it before. That majority of cases are female. Um, is that perhaps axiomatic of like society clamping down on expressing yourself as a female, or is it uh, familial kind of cultural? Why or what is the thinking behind why it's affecting so many more females than males?
Think it's a lot of different reasons. I mean, I have worked with men that have BPD, and I think it I think it presents differently in men than women's. Sometimes there's an overlap. I mean, there's truly, the and I don't necessarily like this term because it means different things to different people, but like the promiscuity, right? Like the one night stand, like that's kind of across the board, men and women, like they'll do that. Um, and the mm, I think symptoms can be misread in different people depending if they're the guy or girl, right? And I think for men, a lot of times it'll come across as like antisocial personality disorder. So depending upon the overt behaviors that are seen, and I could be full of shit. Like I don't know. I don't. Yeah, I'm hypothesizing here. Um, but I think in general, women are more relationship based. Okay. I think I think there's been a cultural way of telling people like a hysterical female, like we're not supposed to have like emotions because if we are, we're like out of control. Um, or I think there's a lot at play, right? But I think in general,
Women may like seek help more than men, and
yeah,
so that could be
perhaps, yeah,
part of it too.
it's a lot of different stuff, and and looking at the disorder, right? I do believe it's on like a continuum, right? Because there are people that might have some traits and they're perfectly fine, like in society, things might not even
Yep.
come up where it's problematic, right? And then there's the people that, I worked with several people in the state hospital level that were like male borderline patients, right? Um, it just typically it's women.
Mm. So, tell us then a little bit more about DBT. And,
Hmm.
you know, so we talked, about, okay, so you're validating maybe how it feels, and okay, it's understandable that you feel this
Sure.
way because this happened. But now, how can I address that? How can I react differently? How can I feel differently? How can I interact in society a little bit,
Mm-hmm.
different? So, what is it about DBT that makes it such a good therapy for borderline personality disorder?
Yeah,
And DB is again, what does it stand for
Uh,
again?
Dialectical behavior therapy.
Dialectical behavioral therapy.
yeah. So DBT, it's just it's kind of a mouthful. Let me just kind of give you a really what is DBT. Okay, so there's several main pieces. So it's definitely an effective treatment for people who have difficulty controlling their emotions and behaviors. That's the aim. Okay, so it also aims to replace problem behaviors with skillful behaviors. Remember, I was talking about like whatever the problem behavior is. A lot of times people don't have the skills or were ever taught how to be skillful. So that's a big piece too. Okay. Um, there's this DBT skills part, which helps people experience a range of emotions without necessarily acting on the emotions. So a big part is, okay, we are going to, is learning how to experience not just positive ones, not just the negative shitty one, but everything and learning that you don't necessarily need to act on those even though you're experiencing it. Okay. It also helps people navigate relationships in the confines of their environment. So what that means is I'm not expecting the environment to tiptoe around somebody because that's not real life. Okay. This helps clients learn how to navigate the relationships out in the real world. Okay. So the overall foundation, the overall um part of DBT is the goal is to help people create this life that's worth living because no one wants this is not a suicide prevention program because a lot of times that's what people think because it's we're going to target life threatening stuff. The idea is who wants to be free of life threatening behaviors and still miserable? Like no, no, no. This is helping people create a life that they want to be a part of.
Yeah, could you tell us a little bit more about? So this is a behavior or behavioral therapy. And a lot of people tend to know about CBT, cognitive behavior therapy, or
Hmm.
Nation of Cognitive Therapy and Behavior Therapy. And people know about talk therapy. They're going to go and talk to a therapist that's like a person-centered approach, perhaps, and
Hmm.
a bunch of different theories there. So what makes DBT so different from CBT? and what makes behavior therapy in general. I think it would be good to
Mhm.
explore that.
Mhm.
Behavior therapy is so different from other types of
Yeah.
therapy.
Yeah, absolutely. So let me kind of give you, what does dialectical mean? Because people don't know what that means. Like a lot of times, so one of the first things I share with people, like my client, is what does that actually mean? Okay. The bottom line, real basic Cliff Notes version, right, is that there are dialectical means that two opposite ideas can be true at the same time. And when considered together, can create a whole new truth and a way of viewing a situation. So, in other words, there's always more than one way to think about a situation, right? So, remember when I was saying about validation, right? And the example about the man who broke her wrist, right? Yeah, like there was not you're hurt, but you broke her wrist. It's the word and, right? The word one of the first tweaks that I tell people, I teach them is replace the word but with and. So I'll give you an example with my daughter, right? And she knows I give examples of her all the time. And, we all kind of giggle about it. Here's an example. I'll say, kiddo, I love you so much and you are really pissing me off. See the difference if I were to say, I love you so much, you're really pissing. That but almost negates the first part, right? And with people with BPD, they look at things all or nothing. That person's mad at me, therefore they must hate me. See what So you asked about
Behavioral therapy in general.
yeah. So
By the way, so dialectical
yeah,
is the word dialectical.
dialectical or a dialectic.
Both things can be true at the same
Mhm.
time. Got it. I love that.
I'm
Yeah.
so glad. I love it too.
Well, no, and I'm understanding a lot more of everything.
I'm so glad. I geek out on this shit. You have no idea. Like I totally geek out on it. It's not even funny.
Well, and that's a great conversation because I'm learning so much. Now, Jamie, your question was behavioral therapy
Mm.
versus talk therapy,
Mhm.
or
Oh,
separate, or
yeah. I mean, I guess that explanation there was wonderful. And so I think we start to see how it gets separated. How would you further separate it from cognitive behavior therapy
No, I love
that
it because it is
I think a lot of people
right.
know about?
There's
Yeah.
parts of it. Yeah. And it is hard because people, so there are several main pieces that creates DBT. Okay. So the DBT is supportive. Like I said, it's not a suicide prevention program, right? It's a life worth living program. It's not like do these things and still be miserable. Okay. It is behavioral, excuse me, in that what that means is we analyze behavior. We analyze problem behavior patterns and we learn to replace problem behavior with skillful behavior. Okay. And I'm just really I'm summarizing, the cognitive piece is this, right? My clients and anyone in DBT will learn to change beliefs, expectations, and assumptions that were once helpful and no longer effective, right? So that's there is a part where we will be learning how to change the way we're thinking. Okay. That's part of it. Okay. Skill oriented means that people are going to learn, they're going to be taught new skills and enhance the capabilities that they already have. There's a separate skills training component to DBT. Okay. There's also this piece, and this is the overarching dialectic in and of itself, right? There, DBT balances acceptance and change. So, DBT therapist will accept where you're at, will accept you, and at the same time will also help you make changes in your life. Okay, so what that means is, okay, it's the humanistic part, the person-centered part. I'm accepting. There's like this acceptance. I'm accepting of everything you have and everything that you're bringing to the table right now. And at the same time, your life is in the toilet and you're not happy. How do we help you change so you can be in this life that you love, that you want? Okay. So it's not all about everything you do. It's not necessarily Rogerian, right? There are parts because I validate. And I'm going to also say, are you hearing yourself right now?
Yeah. So I'm glad you said it's not necessarily Rogerian.
It, that's important.
Yeah. Yeah.
Rogerian, of course, means
Good question.
wait. I don't know. I was gonna make a joke, but I don't know what it means. Rogerian.
He's Jamie, you're in grad school right now.
But yeah. So Carl Rogers
Oh, of course,
is
Carl Rogers.
yeah, like is
Sure.
so like the humanistic approach or the person centered approach, and it's really like helping a person realize themselves what the issue is and realize the path they need to take. And
Cognitive behavioral stuff.
Unconditional acceptance.
it's not necessarily CBT, but a lot of people. I was actually getting into this discussion in graduate school that it's almost as if every theory can incorporate person centered and humanistic. And, it's basically saying like, the best way to teach someone something is to help them learn it themselves. And it's more powerful, right? Instead of me, saying, here's this and here's that. It's lead the student or lead the client, the patient to the answer themselves. And the Carl Rogers approach is the talk therapy and very much like bouncing it back to the client. And after a while, the client realizes like, oh my God, like that's the problem. Oh, that's how I find my way out of this. But it seems like, but when you get to behavior therapy, you're really like, almost prescribing in a way. And I don't want to like describe this the wrong way, but when you get to behavior therapy, you're sort of saying, here's the behavior, here's how to fix it. And that's an oversimplification.
No, it's fine.
Sounds, Sarah, you're very much working with this person saying, yes, we're validating how you feel. It's okay. You're not crazy. Everyone's telling you you're crazy. You're not. Validating how you feel. But the way you're behaving in society is not really working out for you, right? You said you like the toilet, right? So
Yeah.
how can you take these inputs, which you're very sensitive to, and how can you turn them into better behaviors out in society?
Yeah. So
Sounds like, yeah, which is not Rogerian.
make some words here and there. So here's the thing. Okay.
Yeah.
So we explain to people often. People often say, "Well, my DBT is different." All this stuff. People often come to me with one of two complaints that they've experienced. Okay, and most of the time, they're not their first bout of therapy. Okay, so they might have been with a therapist. They might come and say, "Hey, I had this therapist. I really, really enjoyed them. They got me. They understood me." And then I said to them, "Well, when are you going to help me now? When are you going to help me solve my problems?" Right. Now, on the other hand, you might get people that are like, "Okay, I was told I just need to think more positively or change the way I'm thinking." Okay, those are the two complaints, and it's like, where's the compassion, right? So DBT is accepting and changing, right? So it's both, right? So the another key component, the last part that I really want to emphasize here with why or what it is, okay? It's also based on a collaborative relationship. What does that mean? It means that both me and my client, we are both responsible. I often tell my clients when we first start working together, I'm like, listen, my job is to consistently come into therapy in a manner in which you want to work with me. Your job is to consistently come into therapy and continue to behave in ways I want to work with you. Okay. So you understand it's like practicing relationships in real life. So there is a metaphor. Again, I wish I could have created this, Jim. It's like, imagine you're in a rowboat, your therapist, the client, we're in a rowboat. Say the client's goals are on the far end of the lake. My job is to not direct the client how fast to row, which rower, which way, all this stuff, nor is it when my back is turned that the client is drilling a hole in the boat. Do you see what I'm saying?
Yeah.
We're
Yeah.
both responsible for this. So DBT therapy, we're a different breed because we often will bring in how we're using skills in real life. I will often explain, I'm not sharing completely dirty laundry, obviously. I'm sharing how I'm skillful. because that's huge.
It sounds to me also, I mean, in my layman's terms, that it's transitioning
Mhm.
coping mechanisms into skills that one can rely on
Mhm.
to engage emotions and thought so that the behavior is not harmful
Mhm.
or negative.
Mhm.
Does that make sense what I
Yeah.
just said?
No, yeah, I think
Instead
that
of
makes
just
sense.
coping,
Yeah.
like I'm getting through the day, I'm trudging and I'm not cutting myself anymore, but I'm just barely getting by or whatever that, or I'm not impulsive anymore. I'm not recklessly drive, whatever the behavior is that's harmful. It's like it's transiting, it's transforming really that into a positive skill. Is that right? Is
That's part
that what
because a big
okay.
part of it also is learning how to tolerate the painful stuff and not necessarily acting on it, because there's a piece where you can learn to cope with things and you can change things, and sometimes literally the only thing you can do is to tolerate it. Uh, Truly,
Yeah.
you know what I mean?
Eh,
Because people with BPD, one of the like when I talked about skills training, okay, that's a whole separate component. So there's an individual therapy piece where I meet with my clients once a week. There's also a skills training piece, which has to be a completely separate session in addition to that therapy, right? It's not a cheap treatment, okay? Because it's intensive. So the skills training piece, there are 4 modules that target all the quote crazy stuff that no one wants to deal with, okay, in the clients, because it can be crazy making. So there's a whole module, weeks of learning how to tolerate stuff, tolerating stuff so you don't make things worse or destroy relationships, learning how to accept reality even if it's not the reality you want. There's a
mm,
whole mindfulness thing, module where that is the core piece, learning how to just be aware, because
yeah.
you need to be aware of the present moment. Otherwise, you're not going to be able to incorporate the other skills. There's also a piece on um, emotion regulation, and that's where people can learn to change emotions if you can. That's about learning how to check the facts on things instead of just making, well, we feel this way, therefore it must be that we. I'll be like, all right, let's check the facts for a second. And I'm really simplifying this for the podcast, but there's a way to learn how to change things. And the last piece is interpersonal effectiveness, because a huge part of it is people don't know how to behave and interact effectively in relationships. So there's 4 pieces. I mean, it takes at least a good 6 months to get through one cycle of this.
So that's an interesting piece of it too, is that and earlier when we were talking about something being Rogerian, it's just I want to be very, very clear. It wasn't to make Rogerian sound negative
Wow.
at all. It was a massive sort of breakthrough for therapy, what Carl Rogers did. But just trying to separate different types of therapy so people might understand like why they're in therapy, why they go, and what they're supposed to get out of it, and maybe what they should seek out. you know, and they're maybe on a website and this therapist does this and this therapist does that. And what does all that mean? And I think, Sarah, you've been wonderful with clearly laying this out. So a clear difference here also is that it also seems like there's like a beginning and an end. And I think a lot of people think of therapy of like, I'm going to be like Woody Allen, I'm going to be in therapy and have a breakthrough like 20 years from now. It's like, I didn't realize that there were those like 4 modules. I didn't realize you would go more than once a week. And so there are these clear, very clear goals, and therapy does set clear goals, but this seems to be very like, you're going to have this for this amount of time, and then we're going to move on to this and this. I didn't realize that it was so clear in that way.
Yeah,
Really
it
cool.
really is. And there's a lot of work, so people often find DBT as like a last ditch effort because
Mm,
they've tried everything else and it's just it's not helping or working for them, right? So
mm,
um so I mentioned there's 4 pieces to DBT to make it DBT, right? So there's the skills training, there's the individual therapy, okay, each or once a week. And then there is phone coaching, right? So that means, like, for instance, um, it's one thing for my client and I to be practicing skills and talking about things in the therapy room. It's a whole other ball game putting those skills and implementing them when shit's hitting the fan out in the real world. Okay.
Uh,
So and that's what stands apart from a lot of DBT programs that say that they're DBT and they're not, because they don't offer that. Well, I'm glad that they're offering it. It's just not the adherent piece, right? So I will often say, I'm very clear though too. I'm like, if I'm not available, I'm not available. Like, we have a plan. We have a whole plan. All right. The idea here is you contact me or call me before you do the thing, whatever the thing is, right? Because don't call me after you've cut yourself, because that defeats the purpose. Call me before you get to that point, and then I can coach you through it. And it's literally like coaching, like if you were to think of like a coach on a basketball court or a soccer game, it's brief. It is like literally like, did you try this? Okay, go try now. Go, come back, call me, you know. It's brief. It's not therapy. It's like, hmm?
that's a really cool analogy, actually. I never even thought about it in that way. It's basically like coach.
Yeah.
No, that's really,
Hmm.
really cool. Can I ask you, I mean,
Sure.
do you have you had amazing are you willing to share maybe, not obviously, I mean, you must have had amazing successes, with DBT. Have you ever faced in a situation? Well, are you willing to share maybe a situation where you've done everything and it still doesn't work? I mean, does it not take, or do you just keep working with that person, or you restart the cycle? Or I'm fascinated to know what that looks like.
Well, I love that question because we can't, like, first of all, it's not a foolproof thing. It's the gold standard. That doesn't mean that it's flawless, right? And oftentimes when I start working with clients, one of the first things I do is I do a consult. They're free for people because we need to make sure it's a good fit. Like, can I help you? Can you, are you willing to do these things? Like, it's a very, um, there needs to be a good fit. I might not be the best fit for that person, and we might only find that out later, and that's okay, right? Like, we are very schooled on, we can fail at this, like therapists, because it might not be done the way it was intended. It might not be, and that's okay, right? It just means that it might not be the best fit or that type of treatment for that person, okay? People that are in DBT, right? A lot of times, and here's the reinforcement. This is like the leverage, right? A lot of time, like, we will only keep clients or continue to work with them if there is progress. You
Mm.
see, that's oftentimes DBT is often called blackmail therapy, because it's like, you need to be doing this thing, otherwise if you're not making any progress, I can't work with you, right? So that's very opposite than traditional talk therapy, where that means we just meet longer or whatever. Now, again, most of my
Like,
clients that I work with, like, average, it's about 2 to 3 years of weekly stuff. So this is not like a quick thing, which is why insurance companies don't want to pay for it. Okay, they want very, if it's a very, CBT is very much like paid for by insurance companies, because it's prescribed it's a quick treatment, right? For I don't I, and I don't want to speak out of turn here, but for less complex cases. Okay.
right, right.
Um, and for the reason that DBT is so complex and people with BPD are difficult sometimes. Okay. All DBT therapists, one of the reasons I can consider myself a DBT therapist is I have a consult team. I have someone I meet with regularly who also does what I do. And that's where we can,
It's great.
yeah, it's therapy for the therapist sometimes. Or what am I missing? What's,
Or almost like supervision or something.
yeah,
And you provide that for other people and you kind of go back and forth, but that's great. And you kind of mentioned earlier like the positive vibes thing, and you know, it probably didn't make you very popular at Jimmy Buffett concerts, but but I think there I think there is something to be said there about positive psychology going
Sure.
too far, you know. And
Question.
I've seen some articles and I've heard some people on podcasts talking about that. Like, positive psychology, I think, has been wonderful, and I think it is helpful, but you know, when it goes too far, kind of thing. Um, and you know, versus like what you're talking about with DBT and even some other therapies where it's like, do your homework, you gotta do your work, and it's not all going to be sugar coated, and this is what it is, and go ahead, like, you know. So I wonder if you could talk a little bit about that, and about, you know, maybe what you're seeing out there, you know, in sort of like mainstream, you know, culture or society, with maybe going too far with positive psychology, or you know, this idea, anything that might maybe could be difficult for a person with BPD to be dealing with, you know.
mean, I think okay, so I agree that positive psychology can be great. The problem is when you're trying to sell that to someone that has borderline personality disorder and their whole life they've been told just think positively and you'll feel better, because obviously they're not, right? Like, so I think it's important that we just need to be mindful of people's experiences. So if someone's saying like, "Hey, this is really hard for me to experience," like I've been really sad about this thing, like instead of saying, "Oh, don't be sad," right? Because that's what most people will say. Like, of course, I would want to say that too, because who wants to see someone that's sad? Sometimes just the most powerful thing you can do is sitting with that person, sharing that space. One of the most difficult things for people in graduate school was their experience was sitting with someone that was having a painful emotion and not trying to fix it.
Yeah.
Because most people that go to school for psychology in grad school, they're helpers. We're helpers. We want to make people feel better. Like, that's part of being a human being or a parent, or it's really hard. So what I suggest with people, like, sometimes the most powerful thing you can do is just sharing space and not fixing. Sometimes people want to problem solve and help to fix, right? But I think in general, even if someone passes or dies, right? Most people, they'll be like, "Oh, well, that person lived till they were 90, and they're trying to make the other person feel better. And the reality is so sad,
Yeah.
Yeah.
you
Yeah.
know?
Like you said earlier, like accepting the reality,
Yeah.
the sadness.
Yeah.
So as we look to wrap up, I wanted to bring up, so I saw on your social media feeds that, Sarah, you're a weightlifter and you get involved in these, you're picking up giant tires, and you know, like you know, like, you're running through mud, and you know, doing lots of crazy stuff out there.
That could be cool.
Yeah, so how'd you get into all that? It's just the photos, everything looks really
That's
cool.
so
So how'd
funny.
you get into that?
Um, so I've always been an athlete, like high school, like as long as I can remember, I've always been an athlete. Now, when I went to college, that kind of went out the window. And then after I had my daughter, I was like, I need something. And CrossFit has become one of my happy places. And I'm competitive in nature. So the reason a lot of times people love CrossFit is because there's a competitive piece to it, not necessarily with other people, kind of within ourselves as well. I There is something magical about being able to flip tires. There's something magical about being able to like climb up ropes and like, you know, pick up certain weights. It's magical. Okay. Um,
Awesome.
I kind of love it. I love, and there is something scientifically, biologically, intense exercise. There's a reason why people say they have a runner's high or they do these things, because it can, that's one of the fastest ways to, um kickstart your parasympathetic nervous system. Like it creates this calmness or whatever. That, and I also just love the community of people and it's group atmosphere, and I kind of love it.
Yeah, you can see that
Yeah.
in the photos and everything.
I like to do
So cool.
badass. Yeah, no, it's very fun.
Yeah, awesome. And so Pete has developed this habit of wearing a hat now in each of our episodes.
Yeah. Well, this is kind of not really related at all.
No,
Hopefully
no,
they were
it ends up it's usually not
gentlemen.
related. There was
No.
one time when it was,
Oh, that was weird.
but yeah, that was interesting. But so what's the story with this hat?
This I won at a gig I had. That's it. That's simple. And I was like, no way.
Hats
And I
are
won
fun.
this hat. I love this hat.
Yeah, yeah, yeah. I have a Yeti mug that I've been using. This is like one of my favorite. I was chosen, like I applied 2 years ago, and I was chosen to help with the CrossFit Games. I was like a volunteer. We got all kinds of
Right.
fun merch. So yeah, no.
So this strangely related to this CrossFit. Let's see.
And
Pretty
yeah,
cool.
so and that happened last time too, Peter. You had the same mug as someone, right? Now you have the same brand hat mug. Good connection. So, Sarah, thank you very much.
Thank you.
This has been so helpful. I learned so much. I cleared up a lot of confusion I had, and
You were so Rogerian,
yeah,
Jamie. And, like, I didn't even understand you. You were so Rogerian, you know? Like, what is he talking about?
yeah, right. We learned a lot of terms, a lot of acronyms, but you really were very clear in explaining all this to us, and I appreciate that.
Thank you.
So, how does someone find you? So you operate in Pennsylvania. How does someone find you?
My website is the biggest source where people find me, and it's just my name. It's Sara Weand, LPC.
Okay.
Com.
And I'll include it. I'll put it in the show notes and stuff. But Sara Weand, it's WEAND, LPC.
Yeah,
Okay.
or Sara Weand DBT therapy.
Yeah, just Google it.
Finds
You know,
me fine.
yeah, wait, I was actually Googling and you did come up. So good. So people can seek you out in Pennsylvania. Um, Again, thank you so much. This was great. And I feel like if you're open to coming back, we didn't even get into the nervous system stuff.
Sure.
And you know, that's fascinating to me, but there's more to explore here, but you definitely helped clarify a lot. So thank you, Sarah.
Thank you. Thank you.
All right. And thanks everybody for watching or listening, and we will see you next time.